Hi, I'm Trent, and I will be doing my presentation on gender dysphoria and gender identity disorder. And in this presentation, I will be covering the various classifications of the disorder in the past, psychological factors of the disorder, biological factors of the disorder, and the various treatment methods currently being used. So in the past, the first classification of a gender identity disorder was in 1980 in the DSM-3. In the DSM-3, there were 3 gender identity disorder classifications, with transsexualism, gender identity disorder of childhood, and atypical gender identity disorder. And the main differences between these 3 were that a diagnosis for transsexualism had to involve a continuous discomfort with anatomy and a strong desire to live as the opposite sex. A gender identity disorder of childhood diagnosis involved a child rejecting their current anatomy and having a strong desire to grow up as the opposite sex. And atypical gender identity disorder was for individuals that did not fall under the other 2 categories. In the DSM-3R, the revised edition of the DSM-3, there were 3 different classifications of gender identity disorder, with transsexualism, gender identity disorder of adolescence and adulthood, non-transsexual type, and gender identity disorder not otherwise specified. Now, the main difference between transsexualism and gender identity disorder of adolescence and adulthood, non-transsexual type, were that individuals diagnosed with transsexualism had a desire to also medically transition and using surgery to identify as the opposite sex, while those with the latter did not have a desire to transition using surgery and only identified with the opposite sex. Now, in the DSM-4, more changes were made, and this is where the most changes were made between issues of the DSM, where transsexualism and identity disorder of adolescence and adulthood were combined together to become the classification of gender identity disorder. And determining factors for gender identity disorder were made the same when in the past they had been different for males and females. And then there were also new differences in how to identify and diagnose for the disorder for adolescents and adults. So for biological factors of the disorder, it has been observed that in some cases, individuals with gender identity disorder have differing brain development and function than individuals that identify with their gender assigned at birth. But there is little consistent proof to be made that says otherwise, that this is a true fact amongst individuals with gender identity disorder. For psychological factors, individuals with gender identity disorder have a higher likelihood of stress, anxiety, eating disorders, and suicide. Individuals with gender identity disorder often are assaulted and are marginalized in society, causing for stress and anxiety and depression. And then these individuals also often use eating disorders as their excuse and their method to achieve the body shape and body type that they are looking for. And all of these factors combine together to create a higher risk of suicide. Now, Now, treatment. There are two types of treatment for the disorder, with medical treatments being hormone replacement therapy, body modifications like reconstructive surgery and plastic surgery. And then there are also behavioral treatments such as cognitive behavioral therapy and temporary body image alterations